So I am sure that everyone who is listening here is very well experienced with the heel pain patient, and that you get that patient that's coming in saying that they have pain in their heel first step in the morning or at the end of the day. They're getting this severe sharp pain that's preventing them from doing the activities that they love. We all probably have a protocol that we take a majority of our quote unquote plantar fasciitis or plantar heel pain patients through. And what the typical kind of journey or treatment protocol that these patients are being taken through is going to be something that is addressing the inflammation, whether that's anti-inflammatories, maybe they're offered a steroid injection, quite possibly they're going to be offered orthotics, and then they're sent out to physical therapy. And unfortunately, this patient that has had their plantar heel pain for over 6 months may find themselves getting into a cyclical or a waxing and waving pattern. So when I have a plantar heel pain patient, I think that the questions that we ask them is very important. I am always wanting to know not just the duration of symptoms in this moment in time for this flare up, we'll call it, but from a historical perspective. Is if you are now 40 years old, but you were a teenager and were playing a sport, and that's when your plantar heel pain journey started, I want to know that. I want to know how many flare-ups you have had in your course or in your timeline, so that that can help me understand the cyclical nature of your plantar fascial tissue. And when we sometimes get these patients and they say, I've had heel pain for 2 weeks, and we think of that then in this short-term acute phase, we might be missing some of that historical change that's been happening to the connective tissue that's not going to give them the predictable results of what we expect. Now, what I do want to pause and say is that a majority of plantar heel pain and plantar fascial diagnoses will actually go on to heal and be fine. They're the ones that we could go through this flow of anti-inflammatories, mobilizing the feet, strengthening the feet, right? Putting short foot into this. Maybe we give them custom orthotics depending on their level of foot mobility or overpronation, and then the physical therapy again, strengthen the glutes, strengthen the core. A majority of our patients are going to respond. But what we want to think about in today's lecture is what is happening in that outlier, in that 1% of your patients that are not getting better, and they're banging their head against the wall and frustrated and not understanding why they're doing what they're supposed to be doing, and they're still getting their plantar heel pain. So the reality of what we're dealing with this chronic presentation of plantar heel pain, or the waxing and waning patient with plantar heel pain, those are going to be the two ones that we want to really pull out and say, you've had your symptoms consistently for 6 months or longer, or you've had this cyclical pattern of flare up, putting the fire out, flare up, putting the fire out, that is now putting us in a position that this is what we're dealing with. We are now falling into a state of fiber disorientation.